My name is Lesley Dibley and I'm Professor of Qualitative Nursing Research at the University of Greenwich in London, and I and my team received funding from Bowel Research UK to deliver a study exploring experiences of native language-speaking Bangladeshi people living with inflammatory bowel disease, or IBD. We recruited from infusion clinics in one London NHS trust, and we employed a Bengali and Sylheti-speaking research fellow to carry out the interviews. Some participants spoke a little English, but most did not, and several could not read in any language. We found that participants' understanding of their IBD was influenced negatively by their cultural health beliefs. For example, the word disease implied the condition was acute, and participants were confused and frustrated that their healthcare team were only treating the symptoms rather than trying to cure them. We also found that information seeking and self-management were heavily influenced by cultural influences and expectations around food, medication, religion, and gender roles and norms, and that poor levels of cultural competence amongst healthcare providers in terms of language, interpretation, and communication meant that participants distrusted NHS care and had a preference for care from their own country. Our findings highlight why this type of work is important and why more work in this area is needed. Providing a multicultural service for a multicultural community is extremely complex and nuanced. Without understanding the cultural influences and without excellent and effective communication methods that suit the individual, the healthcare needs of non-English speaking patients from any community will not be met. Please donate to Bowel Research UK so they can fund more work like this. More data are needed from larger studies to influence policy changes that filter down to practical improvements at the patient interface.